Update on COVID-19. Let's listen in.
For anyone who needs guidance about COVID symptoms and what they can do in case they have them. I'm going to pass this on to Dr. Ocoranza to give an update on current cases.
Hello, I'm Dr. Hector Carranza, the Health Authority for the city and the county. And as you know, a stay-home, work-safe order is in effect now. And it's going to be until further notice. Why do we have this? Well, this order is necessary to prevent and slow down the transmission of the virus in our community. As a reminder, only a very limited number of businesses are allowed to stay open, and activities are limited to those that are considered essential. It is very important that people know that there is no specific documentation that you need to carry with you as a way to be outside, but we're trusting you, member of our community, to do your civil duty and stick to the rules and the orders that we have given the whole community. We thank you, and we expect the responsibility that each and every one of us have with our community. If you need more information and more details about this order, you can find them on our website, epstrong.org, and this way you can review those orders a lot more in detail. And if you have any questions, please submit them online through an intake form. To report any compliance issues, please contact 311 or send us an email at covidcompliance@elpasotexas.gov. And we thank you for your cooperation with this order, and between Chief Rodriguez and myself, we'll be happy to answer any questions at this moment.
To the media, we're going to start with K-Fox. Please go ahead and ask your first question and follow-up question. K-Fox, if you can unmute yourself, you can press *6.
Let me see if I understand correctly. If the epidemiologist is still contacting people that had contact with COVID-19 or travel history, is that the question?
Well, testing requirements, does that still remain the same?
Well, there is two ways that people can get tested. The testing that we do at the health department does still require those testing criteria. For other people, what we are requiring is only to go to your physician, your primary care physician. He can determine if you need to get tested. He's going to give you an order, and you can go get tested at some private labs. We are mostly interested in see how the disease is affecting the community, so we're giving priority to those patients that are very sick to do the testing through our Department of Public Health lab. Well, we're trusting the community that it's going to do what's good for the whole community. If you used to hike, if you used to exercise 3 times a day, limit your exercise activity outside to 1 time a day. If you're going to be outside hiking, choose a trail that has not much people, or what we're trying to avoid is the big gatherings. When you meet other friends, meet other people, even if it's on the outside, we would love to prevent that to happen. Can we get stricter with the orders? Yes, we can. But we are definitely, all our community, we're asking all the members of our community to put that little piece that you have in your hand to make this better.
Doctor, que si puede hacer lo mismo, decir lo mismo en español.
Ahora en español la pregunta era si podemos hacer que esta orden se pueda enforzar de una manera mucho más rigurosa y si podemos hasta ahorita todavía poder salir a la calle, hacer ejercicio o otro tipo de actividad deportiva. Y la respuesta es de que sí, le estamos dejando a las personas de nuestra comunidad que salgan, que hagan ejercicio, pero lo hagan de una manera considerada. Más que nada, si el ejemplo que les dábamos, si están acostumbrados a salir 3 veces al día a hacer ejercicio, limítela solamente una. Si va a salir a las montañas, vaya por algún camino que no esté muy transitado, no se junte con otros amigos, porque lo que tratamos de prevenir es de que haya conglomerados de gente, porque eso es lo que puede ayudar a que el virus se disperse mucho más fácilmente. ¿Tendremos manera de enforzar más esta orden? Sí tenemos la manera, pero no queremos hacerlo en este momento porque estamos confiando en la capacidad de cada gente de poner su granito de arena y ayudarnos unos con otros a prevenir esto.
Univisión.
Del proceso que se lleva para hacer la prueba por el carro, lo que necesitamos es que vayan con su médico. Su médico es el que es la persona capacitada para determinar si necesita hacerse la prueba y él le va a dar una orden para hacerse la prueba y él tiene que hablar, hacer la cita para que le digan cuándo puede ir. Y también es extremadamente importante que la gente sepa que no va a ir con toda la familia. Va a ir solamente el interesado en el carro y le van a tomar la muestra y esto nos va a ayudar a prevenir la transmisión del virus a otros miembros de su familia.
The next question is open to the Associated Press. Cedar.
Hi, this is Peter. We've been noticing in the response at all kind of levels of government a lot of restrictions on media. So, for example, at the city level, this new testing center, there's no photography or press allowed in the facility at all. This hasn't happened in a lot of other jurisdictions. We saw a great sort of documentation of the testing process by a videographer in another state because you just filmed yourself. And normally in a hospital setting, we can obtain permission for a patient that doesn't mind being accompanied. The El Paso Police Department is sort of barring all ride-alongs. What are the other areas that you feel comfortable at this point sort of limiting press where you wouldn't a few weeks ago? And what are the limits you see on limiting press movement going forward?
Can you please repeat the quote? So the question was, what are the limitations on media in regard to the drive-through space that we have here located in El Paso? So one of the reasons that at this point we're not allowing much media access is, of course, to maintain confidentiality of those that are going into the space. It's also, we're trying to control the access to it as much as possible and make it an orderly process.
The next question, and I will ask media to please mute yourselves when you're not on. The next person available for questions is Mr. Steven Zimmerman.
Hey, sorry, this is Peter with the DAC. It's not really the question I was asking. I'm gonna send an email clarifying the question.
Thank you, Cedar. Stephen, your question?
Sure.
Yes.
Okay, here we go. I'll give you both my questions and then mute myself. The first one is in the lower valley, we're seeing a lot of non-essential businesses that are open, such as title companies, car loan companies, stores that don't sell food, simply clothing stores, things like that. From the time of reporting, how long does it take for someone to come out to see if those businesses are in compliance? And my other question was, can you repeat the COVID hotline number one more time?
Sure. So for compliance issues, you can contact 311. They also have their 311 app that you can write in your issue and submit it. You can also send reports to COVID compliance at elpasotexas.gov. And the phone number for the COVID hotline is 212-6843.
Thank you, Stephen. The next person available, the next media available for questions is KVIA. Please ask your question and a follow-up question.
Hello, yes. The local Beaumont Medical Center says they are assisting the city with COVID-19 testing. How is that working?
The question was, William Beaumont is assisting the health department with the testing. How is that operating?
There has been some collaboration with Fort Bliss and William Beaumont personnel on site, primarily with staffing and coordination of resources. But currently, right now, it's primarily been staffed by area hospital personnel through the Border Advisory Council.
And your follow-up question?
What was the limiting information about the number of tests that have been taken? Can El Paso give that information out to the city and how many tests have been taken so far?
So, in regard to the actual collections of specimens at the drive-through site, as of Monday, when we received our federal assets that augmented what we're currently doing, we've done 100 since Monday. And that's not including the count that we have today. We'll have an updated number for you for that tomorrow.
The next person is Bob Moore. Bob, go ahead with your first question and follow-up question. Bob?
As part of the epidemiological investigation that we do, one of the things that we do is notify the other exposure that he has, and if he travels somewhere else, we definitely notify the other part so they can take appropriate action and proper precautions. Claro que sí. La pregunta fue de UTEP reportó unos casos positivos en uno de sus empleados y querían saber si nosotros les notificamos a los otros individuos de donde había viajado el personal de UTEP. Y la respuesta es de que sí, como parte de nuestra investigación epidemiológica, se les notifica a las personas expuestas en otros lugares o en otras ciudades para que ellos tomen las precauciones que crean pertinentes.
Doctor, y dentro de los casos que ya sabemos que están confirmados aquí en el condado de Paso, ¿se incluye a esos empleados de UTEP y el estudiante de la Universidad de Texas?
Así es, incluimos también esos estudiantes de UTEP y el de la otra universidad. Lo que tratamos de incluir en los casos que reportamos aquí son los casos que tenemos en nuestra comunidad y poco a poco vamos a ir. vamos a ir recibiendo resultados de otros laboratorios que no son del Departamento de Salud, pero también vamos a contabilizar esos casos.
The next person is going to be Molly from the El Paso Times. Molly, can you please ask your first question and follow-up question?
The question was to see if any of these cases were related to the first case. Is that correct? The initial case that we reported that was hospitalized, and the question was if any of the initial cases are still hospitalized, and I believe that none of those initial cases are hospitalized at this time. We are monitoring the cases that are hospitalized because that will tell us more information as far as severity of the disease and how we need to continue our efforts with slowing down of the spread of the virus. At the moment in the county of El Paso, we had 21 cases, and those are the ones that we have up to right now. Y en español, lo que queremos informarles es de que nos preguntaban si alguno de los casos iniciales estaban todavía hospitalizados y hasta el momento no. Todos esos casos iniciales que tuvimos positivos se están recuperando en su casa. Y seguimos monitoreando la situación del virus en nuestra comunidad, poniéndole énfasis a los pacientes que están hospitalizados y que están graves. Eso nos va a dar más idea de la severidad de la enfermedad y ver qué otras medidas tenemos que tomar al respecto. Al momento tenemos 21 casos en nuestra comunidad y seguiremos acumulando más casos dependiendo de todos los reportes que nos llegan de otros laboratorios y de nuestro laboratorio en el Departamento de Salud. Yes, the question was if we can provide a little bit more information as far as the jump from 12 cases to 21. So what we know is that the very majority of those new cases are people in middle age, between 30 and 50 years of age. We're receiving reports from outside labs, and we're still doing our investigation to provide more information in regards to these cases.
Thank you, Molly. Alfredo Cortado, can you please ask your first question and your follow-up question? Okay. We're going to go back and open up for final question. K Fox, do you have one other question?
So like we stated, so again, we're trying to educate the public as best we can regarding what is considered essential in the order. If you go to Section 6, it defines clearly what those essential businesses are. So, of course, we are working with the community, of course, that they do their best to comply. And if there are compliance issues, again, we have a means to address those. If they can utilize 311, use a 311 app, or send an email to covidcompliance@elpasotexas.gov. Now, also for clarification, right now there is no official document or official letter stating that you are essential. Again, the order is very explicit as to what is essential, and each business owner needs to have a good understanding on the meaning of those.
Univision, your last question.
Claro que sí. La pregunta era acerca de los negocios que aún permanecen abiertos, a pesar de que pueda ser un giro que no se pueda considerar esencial. Lo que tenemos que avisarle a la comunidad es de que, por favor, acate nuestras reglas, acate las órdenes. Las órdenes están publicadas en nuestro sitio web y ahí tiene establecimientos que se consideran esenciales. Y hay que usar nuestro sentido común. Sí les vamos a estar diciendo a las personas que algunos de los giros comerciales no van a ser esenciales y necesitan cerrar. No creo que necesitemos enforzar mucho más, pero tenemos que tener confianza en que nuestra comunidad va a responder de la manera apropiada y que sigan las indicaciones que les hacemos llegar y que les hemos dado. La otra cosa en español era de que por lo pronto no necesitan ningún documento oficial que tienen que portar en su carro cuando salgan. Simplemente tienen que ser responsables de no hacer viajes que no sean esenciales. Pónganse de acuerdo con toda la familia para que solamente una persona salga de la casa y las demás se queden en casita, y evitar el aglomerarse en lugares públicos.
Steven Zimmerman, last question. Steven, are you still with us? Okay, moving on to KBA, last question. Okay, go ahead, KBA.
The question was that if the number of 21 cases are including Fort Bliss, and the answer is no. Those numbers doesn't include Fort Bliss. They will keep count of their own cases, and we're informing of what we have here in our county and city.
En español, por favor. En español, doctor, por favor.
La pregunta en español fue de que si los casos que reportamos de 21 hasta el día de hoy incluyen los casos que también tiene Fort Bliss, y la respuesta es de que no. Este número de casos son los que se encuentran en nuestra ciudad y condado y no incluyen los números de Fort Bliss. Fort Bliss va a dar los resultados de la situación que ellos tienen.
Bob Moore, your last question, please.
Thank you.
Definitely, and the question was if we can put in our report of the cases a little more demographic information so the media can inform the community a little bit better, and that is an absolute yes. We will provide a little more demographic information, and as we have more numbers, it will give a more clear picture of how the virus is affecting our community. We are working on that, and we will put that information out to you guys. Y en español, Ahora la pregunta era si podemos dar un poquito más de información demográfica acerca de los casos afectados por el virus, y la respuesta es que sí, les vamos a proveer mucha más información demográfica ahora que tenemos más casos, y va a ser mucho más significativa para dar esa información a la comunidad y darles muchos más consejos y que vean una foto más clara de lo que está pasando en nuestra comunidad.
Molly from the El Paso Times, last question, please.
So, as the question was, how many tests have we done since Monday? And that number is close to 100 at this point since Monday. And again, we're testing patients that have a doctor's order and first responders, healthcare workers, to ensure that our essential personnel are fit and to go back to work and also to ensure that we're not spreading disease to the front line. We're also expecting, so depending on as our recycle is set in place with the federal government, with the packages that we do have, as we use them, we have a resupply already in place for that.
Doctor, ¿si la puedes decir en español?
La pregunta era en español, que cuántas pruebas se han hecho a partir de que abrimos el drive-thru para hacerse la prueba, y tenemos un poquito más de 100 pruebas que se han hecho en este lugar donde se empiezan a colectar las muestras, y seguiremos recolectando mucho más muestras. Tenemos énfasis en nuestros policías, médicos, paramédicos, enfermeros, que son los que están cuidando de nuestra salud, y tenemos que cuidarlos a ellos para que nos puedan cuidar de la mejor manera a nosotros. Seguimos teniendo todas las precauciones posibles, y todo el material que se usa le hemos recibido una parte del gobierno federal.
Any final questions? This is open to any media. The question was, is there any specific date of replenishment?
No, that's all supply and demand as we continue to augment our drive-through, and the more movement we get through that, we already have that system in place to resupply. And again, they're not necessarily the test kits; they're specimen collection kits that are sent out to a lab, a national chain lab, or they're done here locally.
Can you explain the difference between the specimen collection and the test kit?
So the question was, what's the difference between a specimen collection and a test kit? The test kits are the ones that are actually within the laboratory, and where they use whatever comes that's part of that kit to make the determination if once they collect that sample and they assess it, whether or not it's going to be positive or negative. The specimen collections is swabs and other containment materials that they use at the drive-through site or at a doctor's office or wherever they might collect that specific specimen. But it's mainly just a swab and a receptacle to put that and send that to the lab.
Doctor, en español, por favor.
Ahora en español la pregunta era si había algún día en particular que vamos a mandar pedir más pruebas o más insumos para seguir realizando las pruebas, y en realidad no tenemos un día en específico, pero tenemos el proceso en su lugar para poder restablecer todas nuestras pruebas y todos los insumos que necesitamos para seguir haciendo este tipo de pruebas para la comunidad y sobre todo para los que se consideran esenciales. También hay diferentes insumos que necesitamos para realizar pruebas, entre ellos tenemos los cotonetes que usamos para colectar la muestra, unos medios de transporte, todos los insumos que se lleva para realizar la prueba en sí hasta que sale positivo o negativo.
Any additional?
Question was if any first responders or medical personnel have tested positive. At this point, we have not received any positive cases for first responders or healthcare workers.
Doctor, en español.
La pregunta era si había algún caso positivo en enfermeros, paramédicos o personal médico. Hasta el momento no se ha confirmado ningún caso positivo en ninguno de estos grupos de trabajadores.
Last question, please.
The question was that if all those new cases were tested outside of the Department of Public Health laboratory, and the answer is no. There's some that were tested outside. There's some that are tested within the Department of Public Health facility, so it's a compilation of everything. Y en español, la pregunta era si todos estos casos nuevos que tenemos positivos fueron casos que se hicieron prueba afuera del laboratorio del Departamento de Salud, y la respuesta es de que no. Estos casos nuevos es una compilación de casos entre laboratorios particulares y el laboratorio del Departamento de Salud. The question was if there's any evidence of community spread at this point, and we're looking at all the epidemiological investigation that is going on between the cases so we can determine when we start seeing the community spread of the virus. I'm expecting that pretty soon we will start seeing community spread of the virus, and that's why we have given all the orders that are necessary to slow down the spread of the virus in the community. I believe that we're at the right time to start doing these orders, so that's why we continue sending the same message to the community to please follow the orders. This is the right time to do something good for our community so we can go back to normal. Y en español la pregunta era si había evidencia de la dispersión en nuestra comunidad del virus, pero hasta el momento estamos analizando toda la evidencia que recopilamos de la investigación epidemiológica, y yo espero que muy pronto vamos a empezar a ver la dispersión en nuestra comunidad del virus, y esa es la razón por la cual establecimos las órdenes que hemos dado hasta el momento para poder adelantarnos a esto, y le pedimos de favor y la cooperación de toda la comunidad para poder detener y frenar la expansión del virus en nuestra comunidad.
Thank you, Miriam. That'll conclude today's press conference.
All right, once again, city leaders giving an update on COVID-19. You heard Dr. Hector Ocaranza there with the city saying now we have 21 cases of COVID-19 here in El Paso. That is nearly doubled from yesterday. Yesterday we were at 12 cases. And keep in mind, this is only in El Paso County. Fort Bliss has 4 cases, so 21 cases here in El Paso. Now, the city also talking about the stay home, work safe order. It's in effect until further notice. And what's interesting here is you do not need to carry any documentation documentation. If you are considered an essential worker, you don't have to carry any letter or documentation. The city is pretty much just confiding in everyone to follow the order. If you have any questions or want additional information on that order, we have more information on our website, ktsm.com. And that does it for us for now. President Trump in the coronavirus task force, they're coming up with an update for the nation. NBC will break in for that. We will see you back here at 5 o'clock. Bye-bye.
Oh.